Hello, welcome to the Pulse at KCHC Community Health Center. Where we bring you conversation from the heart of our community. I'm your host, Ethel Barrett, Kinston Behavioral Health Practice Manager, and today's episode is a special one as we will be talking about mental health awareness because May is Mental Health Awareness Month. We are diving into a powerful and necessary theme, community over stigma, and hope, redemption, and second chances. And today I have a few guests with me today, and I would like for them to introduce themselves.
Hi, my name is Holly Warren, and I'm the Medical Director of Lenore County Public Health Department, and I'm happy to be part of the team since last summer and excited to be here today.
Thank you.
Hi, and I'm Colleen Kaczynski. I'm the Community Liaison for the Recovery Together ENC Center. I've worked in this community for the last 39 years, but I'm really excited to be able to do something that I really love, and it really gets to help a lot of people.
I'm Monica McGill. I am a psychiatrist and behavioral health director at Kinston Community Health Center, and I'm excited to be here and talk about this important subject.
All right, yes. Thank you all for joining us. I hope this segment today will be able to show how the community can come together to mitigate the stigma around mental health and substance use. So with the stigma around mental health awareness, we find that a lot of people are not asking for help or seeking help. What are some of the things you think that could be the cause of why people don't actually seek the help they need for their mental health?
Well, I think there are several reasons, including access to care. You know, we have such a large portion of our population that is dealing with mental health concerns and substance use. Mm-hmm. And so even though we have so many community partners, we still have the challenge to face of addressing wait times for appointments and the fact that we're human too. And, you know, we miss days sometimes. And so, you know, increasing access is always going to be a goal, and ensuring that we have enough team members in our community to be able to be seen by folks who need care. But the stigma is a huge piece. I think that folks, the majority of folks with mental health concerns don't seek care because of many reasons, including being embarrassed, feeling shame, feeling that they're going to be judged, not wanting to talk to their family members or friends or members of the community about the fact that they're dealing with struggles because they're afraid of how folks will respond.
Yeah. And what do you think is some of the main causes of?
I think that's a great answer, and I agree with what you said. It is a lot of times about access to care, being able to even have transportation sometimes, to be able to get to appointments, to have availability of appointments and being able to get there. And also the stigma, having family members or friends know that you're coming for treatment for substance abuse or for mental illness.
Yeah.
It's something that a lot of people feel like that they're not going to be able to talk to people about, they're not going to be able to get the treatment, or that they're going to be able to start medications and not be able to come off of the medications as well. Sometimes people think if I start something, I'm going to be on a medicine indefinitely, or it's not going to work, or there's potential side effects and risk with medicines too. So there's lots of other reasons as well, but access to care is probably one of the biggest ones.
And I know, Ms. Colleen, that your center actually, you can just walk into the center. And so with that, do you still see a lot of people that don't come up and actually utilize the service?
Sure. We have folks who just have confusing concepts of what mental health and substance use are. I've had family members come in and just say, I just don't understand why they just don't stop, and they don't understand that it's, especially with substance use, it's a brain condition. It's not something that you can just stop, but that's why there needs to be treatment available. When we treat people like their substance use or mental health is a moral failing, is when we really fail people.
Yeah.
And it's really beautiful when we can help educate. And I think education is just so key. If we can educate people about the needs of someone with a substance use disorder or a mental health disorder, and that there's hope and that it's preventable oftentimes and treatable, we can do incredible things to help repair families.
Yeah. Well, that's, and that's one of the things I think a lot of people just don't seek the help because they have people around them that may not understand it. But like you said, education and educating them that these opportunities are out here, which brings me to the question of how have you personally or professionally witnessed or experienced stigma within mental health where, people may, you work in a mental health field, or you work with, these patients, or have you ever witnessed anything of that nature?
Yes, and I'll be the first to say that I've probably been guilty myself sometime in my, history.
Yeah.
So, I acknowledge that I'm not perfect either.
Yeah.
Having said that, the thing that I remember when I think about examples of stigma I've experienced in my medical practice is when I was in residency, I had an attending who taught us, and he's a very well-respected attending who I admired, taught us that once you're a cocaine user, you're always a cocaine user.
Wow.
And thankfully, I didn't believe that then, and I don't believe that now, but it's not true.
Yeah.
It's not facts. But it did influence me, and I've had to think about combating that teaching in the years since I was taught that, and not believing things that are told to me that just aren't true.
Yeah. Yeah. Wow.
Oh, certainly. I see it happen a lot. Yes, just yesterday I had someone come into the center who had wanted to become a patient at a certain medical clinic, and they had the insurance, they had everything. They were taking patients, but they weren't taking this patient. That is really heartbreaking when you are doing everything you can to get and remain sober. We also have laws that are so incredibly discriminatory. For example, if someone is convicted, goes to jail for trafficking charges or other certain drug charges, they can no longer, even after they're released, they've done their time, they can no longer get SNAP benefits. And what that really means is when somebody comes out of prison, oftentimes they have to get a job, they have to find a safe place to live, they have to find food. And this is one resource that a lot of people use for food. But someone who has a trafficking offense, which a lot of people think trafficking, they are like a cartel selling drugs. It's just the level of drugs that they have on them. Oftentimes it's for personal use, but to be forever denied the ability to get food stamps. We don't do that for people with convictions for assaults. We don't do that for convictions of murder, but we do that for a conviction of drug charges. And that just, to me, is really unfair and not a way to help people recover.
Right.
Yeah. I think a lot of people do not understand what it entails when you get mental health treatment either. I think people think that if you're treating people that have mental illness, they can be aggressive or they're dangerous or frightening in some way, and that's not true at all. I mean, that's something that I've had people say to me, you work in behavioral health. Aren't you scared? Aren't you worried about the people you're going to encounter? And that's not at all what you see on a daily basis. That's not what treatment entails. And I think many people don't understand. They also say, is that depressing because you're just going to be hearing this? And you see the benefits that people receive when they get the right treatment, when they receive the right level of care, how their entire lives can improve, the well-being, everything. And it makes such a difference, and it's such a rewarding career. And I think people don't understand.
Yeah.
Sometimes the stigma that comes along with it is so unfortunate, and it prohibits people from going into the field and for getting treatment as well, because I'm sure they experience the same thing that we hear.
Yeah. So I know a lot of times mental health also can affect your physical health. With saying that, what are some opportunities that you offer as a psychiatrist? What are some things that you can offer someone who may, even though they feel, their mental health is causing them not to even take care of their physical health? So what are some things that you offer in that type of thing?
I mean, mental health is medical health. It's medical treatment, and we can coordinate care with their family physicians, with the other specialists as well, to make sure they get comprehensive care. And so it's something that if you just treat one aspect of health, you're missing a significant portion of a person's well-being and overall treatment. So it's something that comprehensive care is essential, and we can definitely coordinate with their specialists, with other providers, to make sure that everyone is getting the care they need to treat all of their medical illnesses and not just one aspect of it.
Yep. Absolutely. I think it's that mind shift, taking mental health and substance use disorders from a criminal justice position to what it is, which is a public health condition.
Yeah.
If we remember that, we're not treating somebody who's in addiction only. They may also have orthopedic issues. They may have diabetes. Would we tell somebody who's diabetic, well, I'm sorry, we're not going to give you insulin because you keep eating cookies? We would never do something like that. But we're very quick to judge people who have a substance use or a mental health disorder. It's, again, I think education is key. We've got to educate first the patient, the person who is struggling with these things, but also the family, the community, and the larger community. One of the things I love that we do here in Kinston is all of our police officers are becoming CIT trained, so that they, when they are called out to a crisis with somebody with a mental health disorder, or substance use disorder, they have special training to make sure to keep that situation from getting worse, be able to de-escalate. Yeah. They also have started a program where if you do have somebody in your home who has a mental health disorder, you can actually notify them, and that way if they come out, for example, for a young person with autism, they'll know ahead of time, so they may not run the lights or sirens so that it would be more activating. Yeah. And so we're always trying to help share that information in the community so that we don't have bad outcomes for the people that we serve.
Right. All right. What do you have in there? I agree completely with Dr. McGill that mental health is health, you know, and that we all in the medical community and in the behavioral health communities just need to treat people as, holistically and look at the whole person. And, I think the times are changing, that we're not focusing on, just one aspect of a person's wellness at a time. We have to look at the whole person.
Yeah, because it could be, if they're having some mental health symptoms, it's because of something that's going on with them physically. So, so if something is, something major happened where they may be diagnosed with cancer or something like could cause them to have some type of mental health symptoms.
Or just limits their functioning in general. And you can have so many conditions that limit functionality, and that can cause them to withdraw, cause them to feel more isolated, and that can lead into other symptoms and progress. And so it's something that we see a lot, and you're exactly right. Holistic care is so essential, and it can really be something that can change a person's life.
Absolutely.
All right. So this is going to be one of the questions kind of based on your organization specifically. So what are some of the things that you all do to battle some of these stigmas and help people, get to to recovery?
Sure. At the Recovery Center and with the Recovery Together ENC, which is part of the health department here for Lenora and Greene counties, one of the things we do is a lot of harm reduction education. So I go out to meetings, to churches, or have people come into the center and talk about the use of naloxone and how that can be life-changing for somebody who has an unintended overdose. We also have lock boxes and this substance called Datera that can destroy medications rather than have them around your home. So we do a lot of that along with stigma training. Everything we do is based on, reducing stigma, because I tell folks all the time, I can't treat a dead person, and stigma kills people every day. And so if we can make sure that they know that there's hope and there's help in recovery, that just can be the most positive thing. we also share information with families about what's there to support them. Like a lot of people don't know, we have an Al-Anon group right here in Kinston, and that can be a really big help for somebody whose loved one has substance use disorder. And so we share that as well. And then we've got all kinds of great programs going on. I need to stop because I'll just go on forever. We've got all kinds of programs to help strengthen that person who's struggling with either mental health or substance use so they can feel more confident in themselves.
I think the number one tool to fight stigma is education. I completely agree with Colleen mentioning that earlier. And the beautiful thing is we're living in a time in history when we have access to information more than we've ever had before.
Yeah.
So, clinicians have the ability to have access to evidence-based guidelines more so than we've ever had. Not only do we have, the internet with reputable web pages, but we have AI now. So any person with an NPI number can access, for example, open evidence, which is a great tool to just at your fingertips give you the society guidelines for addressing mental health and substance use concerns incredibly easily. So, we have access to information, and it's important for all of us to ensure we're staying educated on the up-to-date information and helping our colleagues to do the same.
Yeah.
And helping to provide coordinated care. We have the BHI program here, and that helps with integrated family medicine and behavioral health, and just making sure that no one misses out on treatment and making sure that we have coordination of care together so we can provide different services, different types of treatment that they need. And I think it's overlooked in our community health center. We have dental, OBGYN, family medicine, and behavioral health.
Yeah.
Well, so that's one of the those are all great things that's going on in our community. As we know that Lenoir County is definitely one of the communities, one of the rural communities that often does not have the access to care as it should. So being that, I think it's great that we all can come together and just have this conversation and understand that we are here for them. We are working together to try to combat this stigma around mental health and give people the hope that they can really just walk into a place and say, hey, I'm not feeling like myself today. I need some help. Or I have this addiction. I don't know where else to turn. But you have these places that you can come to, and that we definitely have resources for you. And offering hope. And like I said, today's segment is mental health awareness, hope, redemption, and second chances. You do get a second chance at recovering and redemption. There's nothing wrong with coming in to say that I need the help that I need, and you have people here who's willing to bring the services to you. Is there anything else that you would like to add to this segment? I know that we spoke on a lot about stigma around it, about getting people to come in, but anything that you would like to add just around mental health awareness and anything, special events you have going on?
Well, I think one thing I'd like to add is something that I frequently tell my patients is to be a squeaky wheel, like to seek help and to continue to seek help and to speak up when you need help. And that way folks can hopefully be available to help. And that's our goal. We do have an event coming up at UNC Health Lenoir on May 5th.
May 5th.
Okay. For discussing substance misuse stigma that day. So we'd love for folks to come out from 8 to 10 or from 12 to 2 that day. Okay.
I'd love to share, at the center, which is on the corner of North and McElwain, we have ongoing free programming for anybody in the community who struggles with mental health or substance use. So we have recovery groups that meet on Tuesdays and Thursdays. We have AA that meets on Monday at noon. NA meets on Wednesday at noon. We have a GED program in the evening. We have Tai Chi. That's kind of a newest thing where you can meditate and stretch and all of that. That's Mondays at 1. We have a back to work program where folks who are unemployed don't have to have mental health or substance use, but they can come and get training. And it's a 5-week program, but to be honest, most folks are getting jobs before they finish those 5 weeks. So that's been really wonderful.
Great.
We also have our reentry program, and that's specifically for people who are coming out of jail or prison or who are on felony probation. And we can help those folks with things like housing, employment. We're really successful in working with the community, businesses on employment, sometimes food and other resources to help somebody, because folks who leave prison, about 95% are coming right back to our community. So it's so much better if we can make sure they're connected to resources. And all of this can be found on our website, recoverytogetherenc.com, in the community section.
All right. I think one thing that I like to add is that you're not alone. And I think that's the one thing I hear most from people is that they feel alone. They feel like people have not gone through this successfully. They've not recovered. They've not healed. And people are not alone. There are many people who go through mental health and substance abuse. And it is something that you can get treatment for. You can have a successful, productive life. It doesn't have to hold you back from your dreams, from your goals. And I think that you're not alone. There is hope. And many people do recover successfully and can be there to support you. And we offer MAT programs for substance use. We have outpatient medication management. We have therapy, individual and group sessions. So there's lots of different services that we offer to help you to begin your road to recovery and to be able to be productive and have successful lives and reach your goals. You're not alone.
So that's the end of our conversation for today. But I'm pretty sure that if you're willing to, if you want to reach out to us, we'll have everyone's information at the end of this video, where you can reach them if you have questions or concerns, and if you're seeking services. We also will have that information as well. I appreciate each one of our guests today coming in, because this was something that I really felt the need to do as we all work as a community to help combat the stigma around mental health. So thank you.